with you was Sam. My name's Jessica. I am a student at McKendree University going for my bachelor's. And this is for a leadership and management class. My PowerPoint is on Hcahps. Do any of you guys know about Hcahps? Heard anything about it? Okay. So this is basically, I had a couple of objectives for you guys to learn during this presentation. That you will know what Hcahps is and what the survey is used for. The information that's provided will provide you benefits while in the clinical setting and when actively working as a nurse, especially in the hospital. And then it will provide you with an opportunity to gain increased knowledge about Hcahps and reinforce why patient satisfaction is important. So what is Hcahps? Hcahps is the Hospital Consumer Assessment of Healthcare Providers and Systems survey. The Hcahps survey is the patient's perception of the hospital and how they perceive their stay. There are 27 items that are on the survey, and it has been in use since 2006. What the survey did was create a national standard for collecting and publicly reporting information across all hospitals. The Centers for Medicare and Medicaid, along with the Agency for Healthcare Research and Quality, developed the Hcahps survey. If a hospital receives inpatient prospective payment systems, annual payment provisions, they are required to participate in the Hcahps survey. If funds are not received, then it is optional to participate in the survey. It is a requirement of hospitals to submit their Hcahps data in order to receive full reimbursements. With public reporting, anybody can view and compare Hcahps scores. The survey permits patients to provide feedback of the quality of care received in the hospital and also can provide patients the opportunity to compare hospitals when selecting to receive care. There were three main goals when they were creating the Hcahps survey. So, production of data that allows objective and meaningful comparisons of hospitals on topics that are important to patients and consumers. New incentives are created for hospitals to improve quality of care. And it also enhances accountability in healthcare by increasing transparency of the quality of hospital care provided in return of the public investment. These are the topics that are on the survey. So nurse communication, doctor communication, responsiveness of hospital staff, pain management, communication about medications, discharge information, cleanliness of hospital environment, quietness of hospital environment, and then they can give an overall rating of the hospital and the willingness to recommend the hospital. There are several different collection methods to where we can get responses. They can send a survey out through the mail. They can call and ask the questions on the survey. They can mail the survey and then do a telephone follow-up, and then also interactive voice response. Who receives the survey? So a random sample is chosen of adult inpatients. Scores are looked at from inpatient patients from medical, surgical, and maternity care service lines. And they do not have to be a Medicare patient. The survey is administered to patients who are 18 years or older at the time of admission, at least one inpatient overnight stay, non-psychiatric principal diagnosis at time of discharge, and they have to be alive at the time of discharge. Exclusions from the survey. Patients discharged to hospice care, patients discharged to nursing homes and skilled nursing facilities, court/law enforcement patients, so prisoners, and then patients who have a foreign home address do not receive the survey. The survey is administered within 48 hours to 6 weeks after the discharge of the patient. Data collection is to end no later than 6 weeks after the date the first survey is mailed or the first telephone this is basically what the scores look like that the hospital gets. This is actually from Memorial Hospital. It breaks down the scores on different units. I took off the units of them, but the red is where they're not doing so good. The blue is really good. The yellow is where you want to be, and then the green is the middle. When you get the blue scores, that's when the patients are saying always on the survey. And then you can even go to the Medicare website and you can compare different hospitals. So what I did here is I pulled up comparing St. Elizabeth's to Memorial Hospital. And this just shows how they responded on the survey, like where the hospitals are scoring. So when you compare the two, they're pretty much comparable, and then it also shows the Illinois average and the national average. And this is going through again as well, and these are the questions that are asked also on the survey. And then if they definitely would recommend the hospital, that's also the score there. So this is a little sample of the survey. I have one to pass around. This is the actual survey that they mail to patients. And you can look through and see, it goes through the questions that are being asked to the patients. And this is, so basically they ask, communication with nurses is the big thing, with the doctors, the environment, and then the experience that they had. So one of the big things on the unit that I work at the hospital where we're struggling at is with medications. Patients don't always answer well that they understand the medications that they are taking and the side effects that can happen from them. So the importance of basically explaining medications is obvious. If a patient is discharged home and we give them a new medication, say a blood pressure medication, and they don't know that it's for their blood pressure, it could harm them in the long run. Say they're not taking the medication, so then their blood pressure spikes too high, or their blood pressure is at a low number, and then they take it, and it drops too low. So it has been found that medication-related errors and discrepancies may occur in as many as 8 out of 10 patients that are discharged from the hospital. So when you think about that, the patients, we're sending them home with these new medications, say they're not taking them, they're taking them improperly, then they come right back. And then many changes are made while a patient's in the hospital also, so there needs to be clear explanations for the patients. And as nurses, we should be explaining to the patients each time we're giving them the medications, why they're taking this medication, so when they are discharged from the hospital, they understand the purpose. And then communication also matters. So the communication with patients is critical, so they follow with the care plan that we have planned for them, and they also do the clinical interventions. Say a procedure, if a patient doesn't understand the procedure, then we obviously fail with communication. And the healthcare team needs to listen to the patients and also talk to patients in an effective manner, explaining the information in a way that the patient will understand. Sometimes we use big wording that patients may not understand, so sometimes you have to bring it down to their level and communicate in a way so that they understand what we're doing and why. And it is a big focus on the Hcahps survey. So, in conclusion, each interaction with patients can influence how they perceive their hospital stay. Each and every person the patient interacts with can make a difference. So, do you guys have any questions? Yeah.
So how do we find the scores? You said we're allowed to review them. How do we look those up?
Yeah, I basically went to Google, and it's on the Medicare website. You can type in what city you want to search for, and then it will let you compare. You can compare up to 3 different hospitals, and that was on the Medicare website. So you can see the breakdown of how other hospitals compare to you. I know it's a big focus where I work. Every staff meeting we talk about Hcahps, we talk about what patients are saying, and it's a reimbursement to the hospital, so they actually base reimbursement to the hospital off of those scores that patients are giving. That's why it's kind of a big deal in the hospitals and
Basically, patient satisfaction. That's scary. 8 out of 10 patients
With medication errors.
with medication errors.
That's a huge one.
But when you think about it, there's times where I'll be discharging a patient to go home and you'll be going through medications and some of them are like you really have to break everything down, you know, this is for your blood pressure, why, like, so they understand why they're taking it and the reasoning behind it and making sure they actually take it and take it in the right way.
But that's almost, to me, like, especially with the older adult population, it'd almost be good if they had a home health follow-up, where a nurse actually has the pills in front of them, and maybe one of those Monday through Friday, and can show them what the pills look like. This is what you're taking, re-explain it, and show them how to set it up the first time. Because I know even I'm not an older adult. Well, I'm getting there. But even when, and it's not even for me, like when they've given me instructions on my kids because we made an ED visit or something like that, I'm having to go back to the literature all the time and double check what they tell me to do. So I know that helps me. Like, I mean, I hear them. I'm even a healthcare provider, but sometimes you're just in a stressful moment. You're kind of trying to take it all in, and it's coming at you fast. And then when I get home, if I didn't have that literature, I've even had to call and say, I'm sorry, did you tell me I was not supposed to do that for 2 days? Or,
And that is,
you know.
that is one of the things. We will give the number for the unit on the discharge paperwork, so if they need to follow up, they can call. And then they also get that big old packet with them that they can look through again. And like you said, home health is great.
I just wonder for the older adults, because I know if I'm struggling to keep it all straight, and I'm not even at that stage in my life, and it's even not about my kid, and I'm truly clear-headed. I'm not the ill one, and I'm still questioning things I was told. But it might be harder for an older adult to read that stuff, or it might be harder for them to open the bottles.
And even getting them to fill the prescriptions.
Right.
Making sure all of that.
I did have another question. So I know you said it's anybody over 18. So how do we have 2 big pediatric hospitals in St. Louis. How do they get Hcahps scored? Does it go to the parents, or they have a whole different system for pediatrics?
I think they would have a different system of how they do that. I'm not 100%.
So they might have something other than Hcahps.
Because Hcahps is basically Medicare, so most kids aren't going to have Medicare as their primary insurance. That's a great question. Anybody else? So if you'll fill those out for me, that's how you guys felt about the presentation and if you guys learned something. And I hope you learned something from this. I appreciate the time that you guys took to.
Good for you getting to be on time. You gonna keep going or you stop?
I haven't decided.
Keep going, it's all gravy.
Can I stop?